The first question I'd like to answer today that's been sent to me is, why are benzodiazepines addictive? This is a very complex question because the mechanism of how benzodiazepine works, although it's a few receptors, is very complex. I think a good way to break this down is to one way to answer this is, let's break it down into three questions. Or three reasons why they are addictive. One is the pleasurable effect. The other one is the tolerance, and the third one is the withdrawal symptoms that you have from these. So the pleasurable effect, the tolerance, and the withdrawal symptoms that you get. As far as the pleasurable effect, you don't see people initially using this medication for pleasure unless if they're using it to attenuate other drugs or alcohol. In particular, oftentimes you see this kind of mixed in with opiates, and you see this mixed in with alcohol, and it's really either substituting one or, and usually in the case of alcohol, or adding to the effect of the other medication, oftentimes opiates or heroin if you're using it illicitly. And when people do that enough, they start to kind of develop that tolerance and have withdrawal from it, and then they start to run into trouble. General tolerance, what happens is that, as far as the anxiety parts of this medication, you don't see it. It takes a lot of time and a lot of use to get to a place where the effect, you have to build a tolerance to the effect for anxiety. Oftentimes you see these when people are using it for sleep, because you can build a tolerance to the dose pretty quickly. The other issue as far as the tolerance goes, as far as the mechanism goes, is at the receptor site, there's a couple of different ways they describe this and a lot of discussion in the literature. One of them is called uncoupling effect. And what that means is that where the benzodiazepines bind, the usual substrates that bind into that receptor, the GABA receptor, uncouple, and they're not as effective. And so that really kind of leads into the need for tolerance, and you're going to need more benzodiazepines to substitute the normal substrates that go into that GABA receptor. Finally, the withdrawal symptoms, once you start to build, and all three of those that I said, whether it's the pleasurable effect or the tolerance or the withdrawal symptoms, they're all kind of related. One feeds into the other. The withdrawal symptoms from this medication, secondary to the tolerance that you build, and possibly the uncoupling effect that I described, make it very painful. If you talk to people that are withdrawing from this medication, they say it's much worse than opiate withdrawals. And again, as I discussed in another video, the class of drugs that this falls under, sedative hypnotics, are the only withdrawals that can cause illness and death, seizures and death. It's a very dangerous class of medications to mess around with at one level. And the way the patient feels psychologically and physically, they have everything from hallucinations, visual changes, just a very nasty feeling of uneasiness that patients get that can be described as severe anxiety. Some of them even describe out-of-body experiences. It's a very torturous withdrawal. All of these things that I just described kind of contribute either individually or hand in hand to why this medication is addictive. Benzodiazepines are addictive. The second question I have, what are some of the common benzodiazepine addiction signs? Well, if you're prescribed the medication and a physician is kind of watching this, if you find yourself using more and more outside of the prescribed dosing, that's a sign of addiction. On the other hand, some of the other signs of addiction, whether you're prescribed it or not, are A, the same thing. B, if you're starting to have withdrawal signs, if you stop the medication, and that's when you start to really, you're going to have to put the brakes on there. The third question I have is, if you are prescribed benzodiazepines, how can you prevent addiction if your tolerance rises? I want to take a minute to really answer this question. We're talking about prescribed benzodiazepines, and I think this is, as I said in another video, this is a hidden epidemic. And people often talk about how doctors overprescribed opiates and they created the opiate epidemic, and I am a physician. I will say that we have been very much overprescribing benzodiazepines. That's number one. If you look at the number of prescriptions from the 90s to about 2015 was the last recent article I read in New England Journal of Medicine, but it went up by almost 70%. I don't think that indications or number of people that needed this medication went up by 70% from 1990s, late 90s to 2015. Number two, I think the dosages that we're giving are very, very, very high, and they lead themselves much more to the abuse potential. Number three, if you look at we talk about the opiate epidemic and the deaths, again, from the late 90s to 2015-16, it went from 1,000 something to overdoses from this medication to over 8,000. That's an eightfold increase. And we're not talking about it enough, and we're not educating prescribers enough about this. And finally, one other thing that's a topic of a little bit of controversy, but in the academic literature, but I'm going to lean on a side that, just from my clinical experience and some of the data kind of bears this out. People are being prescribed these medications for too long. I'm going to say that for 95% of the folks that are prescribed this medication long term, they should not have been prescribed it long term. There is a small group of people, 5% maybe, and again, I'm taking a guess at this, that can have to be on this medication long term. But again, we go into that sort of consumer economy, capitalistic economy where, the more, the better, and the longer, somebody's making money off of this along the way. So I'm going to say that when we got into this problem of people having to deal with the addiction and be concerned about the addiction of this medication because of all of these factors. Now, if going back to the question, if you prescribe benzodiazepine, how can you prevent addiction if your tolerance rises? I think it's at this point where you start to notice a tolerance rising. You need to go into your physician and discuss that and have this managed very, very closely. Most importantly, I think the physicians that are prescribing this medication, including myself, have to keep a very close eye on the patient and look for signs of addiction or abuse or rising tolerance by seeing if they're coming in for their prescriptions early and seeing the patient on a regular basis and discussing and re-educating about the abuse potential of this medication. I think that is really, really, really important. I hope that gave you some information on some of the addiction properties of this medication. If you're interested in learning more about this medication, please click on the video above, and I'll see you there.